welcome everybody who's joined this evening for the live portion of this particular webinar, as well as anyone who's joining offline when the webinar is archived. And this is the 5th installment in Epilepsy Ontario's Knowledge is Power webinar series. Tonight we'd like to welcome our guest speaker, Mr. Robert Moss, and he will be talking to us about improving seizure outcomes through online seizure diaries. A little bit of background about Rob. And so Rob is co-founder of SeizureTracker.com, but tells me that his favorite title is Evan's Dad. And you may hear a little bit about Evan as Rob goes through the presentation tonight. Rob is the father of a child with tuberous sclerosis complex, or TSC, and epilepsy. Seizure Tracker is a comprehensive online diary system designed to empower individuals in their own treatment and improve patient-doctor communications with a new focus on the importance of genetics in epilepsy. Robert is dedicated to empowering people living with epilepsy and giving back to the community that he is also very much a part of. And I think you'll find that the information that Rob has to share related to the benefits that can be obtained using online seizure diaries and all of the features that are available through Seizure Tracker will be quite helpful for you and hopefully for other people that you know as well. So Rob, welcome and thank you very much.
Thank you, Suzanne. It's an honor to be sharing both Seizure Tracker and a little bit of the background behind why this web resource was developed. And again, it's an honor to be presenting for Epilepsy Ontario. So I'm just going to run through a few PowerPoint slides to give you a little bit of the background of Seizure Tracker, and then I'll give you a little bit of a demonstration of the site and some of the features, and then we'll move on to talk a little bit more about how to really leverage the site in both clinical care and managing personal situations that involve seizure diaries and seizure control. So just as we get started, let me move through these slides. I just want to talk a little bit about the impetus for Seizure Tracker and our family. So our son Evan has tuberous sclerosis complex, which is a genetic disorder that causes tumors to grow throughout your body, pretty much any organ in your body. So Evan, this is Evan and his sister Aria. Evan's pregnancy was very normal. He seemed very healthy when he was born. Unfortunately, the seizures began in the first month of his life. We actually were going to pick him up one day at his daycare provider, and she said, you know, he's been doing these weird twitches with his arm, and his eyes are doing really strange things. She suggested we take him into our pediatrician. Shortly after that, Evan was diagnosed with cortical dysplasia and epilepsy and continued to have seizures. We put him on medication for about 2 years, and he'd gain weight, and we'd up the medication. He'd have more seizures, breakthrough seizures. We'd up the medication. The seizures would slow down a little bit. So about at the age of about 2, we went into our neurologist and asked why at some point these seizures kept increasing as he was getting older. And the neurologist decided to order another MRI at 2, and he noticed that there were now 3 spots on Evan's brain that were malformed or looked like they could be actually tumors. So we waited about 6 months and then went to the Children's Hospital locally and got another MRI, and the radiologist came in and asked us if we knew what tuberous sclerosis complex was. And when we said no, he quickly turned around and ran out of the room. So this sent us through a roller coaster of testing and research, and my wife and I sat down and spent hours on the internet and read a lot about tuberous sclerosis, and then we started really trying to figure out if that was exactly what he had. So we did all these tests. Evan had multiple MRIs. He had an abdominal scan of his kidneys. He had skin exams, ultrasounds of his heart, and ended up that Evan actually had 3 brain tumors and multiple kidney tumors. So we went on for a few years just juggling medicines and trying to get his seizures under control. This is Evan, I believe, when he was about 3.5. He had been on 9 medications by that time, and with no control of his seizures. We really noticed that that the medications we were putting him on would just changed him. They changed his personality. They changed the way he interacted. They changed how he was learning in school. And not only that, the seizures weren't stopping. They were just increasing. And so in the summer of 2007, we started exploring brain surgery and looking at other options than medication for Evan. At that point, he was having 300 or 400 seizures a month, and we knew knew that brain surgery was an option, and finally decided to do that. So this is Evan as he was having a 3-stage focal resection at New York University Hospital. So Evan was there for about a month. He had 3 craniotomies, 3 brain surgeries. The last surgery, they removed most of the tumors that we knew of were there at the time, and walked out of came out of the OR basically seizure-free. So that was in 2007. Upon leaving the hospital, he had to do all of those things that he had learned previously. He was doing physical therapy 3 times a week, and just trying to relearn most of that muscle coordination that he had lost from being in the hospital for so long, and having surgery that was real close to where his motor strip was in his brain. This is Evan actually 10 months after surgery. I remember this day, and my wife and I, were sitting at the bottom of this rock and watching him climb up this rock face, knowing that we had definitely made the right decision at the time to do brain surgery. So as a part of dealing with all those seizures and medication changes, we were really having a hard time going into our doctor's office, and the doctor's appointments kept getting shorter and shorter, and we had less and less time to spend to explain what was going on with Evan's seizures prior to his surgery. So we sat down and started thinking about ways to record Evan's seizures, and this is actually the sheet that we were given as Evan was leading up to surgery by the local neurologist. And as you can see, it was basically an attempt to collect 365 days worth of seizure activity and medication changes on one sheet of paper. So this really wasn't going to work for a child who was having 300 to 400 seizures a month, and then pretty much having medication changes sometimes, 3 times a month or 4 times a month. So we really needed to understand how to make these medication decisions far less subjectively than these doctor's appointments were allowing us to do. So we created Seizure Tracker as a personal tool. At first, we started using the site to log Evan's seizures. We knew we wanted to have a way to collect it easily, so we made these printable sheets and then would log on these printable sheets and then would go back to the web interface we had built to log in Evan's seizures. So prior to Evan having surgery, we actually took it into our neurologist, and I had incorporated these graphing components that let us look at his past medication and current medications and how that affected his seizure counts. So we took it in, and our doctor asked us to make it public, and so we sat down for 4 or 5 months and really worked through a public interface for it. So that was in 2007. We actually launched it from the waiting room where Evan was having surgery. We posted it on the TS Alliance listserv that it was a free public resource, and it was kind of an amazing experience. We had, that night, we had 50 people sign up to use it, and within a week we had 250 people using it. As you can imagine, if a family sitting here in the ICU at the hospital while their son has brain surgery, and I was thinking, oh my goodness, not only do I have to take care of my son, now I'm responsible for 250 plus people to make sure that this resource is available for them forever now. So in 2007, Seizure Tracker was launched. We currently have over 17,000 global users. We add 250 to 300 new users a month. So seizure events on the site are getting close. These are a little bit dated numbers, but we have almost 1 million seizure events logged on the site and probably about 50,000 medication entries. So the uptake has been quite amazing, and it's been quite a roller coaster ride for us over the past 7 years, but quite enjoyable and really fulfilling. So in developing the website, we really were focused on how do we empower ourselves to help our doctors make better decisions, and how do we create a tool that will let us play a larger role in our own healthcare. And so we really wanted to focus on the ability to take our data that we were collecting and move it around so we could show it to multiple doctors and multiple epilepsy clinics, and we wanted to be able to access it more easily from multiple places. And we really wanted to think about how do we help ourselves and help other people learn about the different treatment options that are available for epilepsy and seizures. And in that, really work on our tools that are provided on Seizure Tracker in a way that is more educational, that we can provide the terminology that our doctors use, so we can and define that in the site for our user base, so they can go in and talk very educatedly to their care providers. Let me now try to switch over real quick to the website and show you all a live demo account and show you some of those features. So this is actually a demo account from the site, and as you can see, once you've logged on, the site is based around this calendar navigation. This is the control panel page. So it's the first page that you see after you've logged on, and it's all based around these calendars. So the red in the calendars indicates seizure activity. The yellow indicates when you've scheduled a doctor's appointment. And all of these are linked to those days. So you can basically click on those squares to go to a day to log a seizure or other surrounding treatments. The control panel page is scrollable by 3 month or a year, and you can edit profile information, weight, age. We have a VNS, vagus nerve stimulation therapy tool on here, and we also have a diet tool. So you can actually come in and enter in VNS settings and collect those. You can enter in medications. I'll show you the medication list real quick. So this is the tool to enter in. We have a database of all of the epilepsy-related medications. You can enter in a total daily dose, the day you start that dose, and the day you end that dose. And then, again, about empowering ourselves to collect that data, make sure we can share it easily. All of that medication history is stored on the site. You can go in and edit these and take notes and things like that for these medications. From this page as well, you can create reports. You can have access to a very extensive help section. So anywhere on the site, you can click on these yellow question marks, and it opens up a page in the help section that's related to the page that you're actually on. And then on this side, you can do all of those things, all of the things listed, including create reports. And I'll explain the Valet system in a little bit, but that's accessible here as well. So clicking on one of the dates brings us to the seizure log page. Now this is when you'd want to collect data for a specific day. So you'd click on that day. June 26th is up here. You know the age on that particular day by month. It lists out how many events were logged that day, what medications were actually scheduled on that day, not necessarily what's active. But if you went to the seizure log for a particular day, if it's the current day or a future day as well, you could see what medications were listed in that schedule. Also, we have a rescue medication tool that you can enter in unscheduled medications. So if you have a status seizure or a long-lasting seizure that you use rescue medications for, you can enter that in here. Then we get into the seizure event specifically, or seizure event information that's specific to one particular event. So in this heading information, you can record the time the seizure happened, how long it lasted. We have a list of seizure types, and again, you can click on the yellow help section to define what those seizure types are. We also have a really interesting tool that allows you to copy and paste YouTube videos into the form here, or links to YouTube videos, and then those are attached to the event and viewable later on. So we were being asked a lot to record Evan's seizures by video when his seizures were changing in type, and it was helpful for the neurologist to diagnose and treat the specific type of seizure he was having by looking at these videos. So we decided to add that tool on, and then instead of having to email the doctor the seizure information and a video later on, you can actually combine it all through Seizure Tracker and share it in your Seizure Tracker reports. Again, we have a VNS tool. It allows you to record how many times you used the magnet, who it was used by, and if it was had an impact or not. We get into the body of the events, and we like to think about what actually might have caused the seizure, so you can indicate those. And these are all simple check marks, so you can come in and check or uncheck all of these, and then the site actually remembers all the values from the last time you you entered a seizure. So you can quickly go through and just fill out this header information. And if you're having very similar seizures, you can just browse over this real quick and click record, and it'll record your seizure with the same values from the previous one. So triggers, description, so just a brief description of what the event looked like. You can also customize these forms a little bit by adding in your own textual content to these other sections. And the textual content is remembered as well. For each section, you can add your own notes. So if you wanted to, you could even enhance the data that you're sharing with your doctors further by adding in descriptions that are non-standard. And then post-event, so what actually happened after the event after the seizure was finished, and what was the cause of the seizure. So then you get to the bottom of the page, it actually lists out everything, all the events that were recorded on that day. And as I mentioned, you could add those YouTube videos. So if I view this here, I can actually click on this. It'll open up a window of the video, and I can actually watch the video directly within Seizure Tracker and not have to go straight out to YouTube to watch the video. So on the right side of the screen, we have another calendar interface. On this page, it's only a month long, so we can scroll by month and year down here. And again, the red indicates seizure activity on that day, and yellow indicates doctor's appointments. So we can schedule appointments here. These are all things that relate to the day, but not necessarily a seizure. So we can schedule appointments. We can take medication level. We can record medication levels. So I'll do that real quick. We could say we had a level of 16 that was taken at 8 a.m. And it was a trough or a lower point in the blood levels, or I could say I don't know, but a trough or high or a peak, and I can add that in. Then that's collected. That's collected up here, and that'll be showing up in the reports, and I'll show you that fairly shortly. Also, you can collect things like daily variables, and then you can also collect daily notes. And all of this stuff can be recorded in the site, and then we can go and create reports. Now, when we were building this site, we were really thinking about how do we share this tool, and what do we do with all the information. So this is a sample seizure tracker report. It's 3 months long, and you can see it has some profile information on the top. It has the date information of the report itself. Then we go into weekly counts of seizure activity by month. We have a graph on the site that looks at seizure types, so against medication. So you can roll over these graphs when they're viewed online and see the medication dosages, seizure types, or seizure counts by type. And then if the graph is a little busy and you or your physicians want to simplify it and look at a certain seizure type or medication against one another, you can actually just click on the things and simplify the graphs. And then we would see here that maybe with this medication, down dosing this medication actually increased this seizure type. This graph is actually the seizure count by day and medication, along with multiple other data points. So like I said, when we entered in all of that data into the site, it's all visually represented in this graph and in the text included later in the report. So if you look, these are medications that are scheduled on those days. You can see here that's a medication as well. Seizure counts, so I know there was an increase in seizure activity here. I mentioned there was a VNS tool, so you can roll over and see what the VNS was set on. this day. The big dot indicates that there was a change in setting, so this setting is going to be different than this setting would be, and you know that by that indicator. I mentioned rescue medication, so this is a indicator of a rescue medication. Look at this, that blood level that we just entered in is now represented on that graph. And daily variables, you can record things like missed medications. And again, simplifying this graph just by clicking on the legend down below. The seizure by time of day graph, so when you enter in the time of your seizures, as you create these reports, you're able to look at trending of when they're occurring, and just a simple change in medication may actually reduce seizure activity. We launched this this graph because we were doing a lot of things with Evan to adjust his medications, and he at one point was on medication dosages 8 times a day. So we're really having problems with his metabolism, and this graph really helped us understand when the seizures were happening at the time of day and then how to adjust his medications. Once we launched this graph, we actually started getting emails like a month later saying, oh, I'm recording my seizures with Seizure Tracker and have been recording the times, and I actually took a report in to my doctor, and now I'm seizure-free. Just with a subtle change in the timing of when the medication was given. So these reports also include all the textual information that relates to the information on the graphs, and you can include also the daily notes. And you'll notice again, here's one of those video icons for when that video was attached. The reports themselves can be printed or they can be emailed from the site, and they're all dynamically driven, so meaning that they're created whenever someone comes to the website. So this report can be shared through a URL, and someone can just visit this web address with the report ID number and see this same exact Seizure Tracker report just by sharing this URL, or you can email it directly from the site. So I think those are some of the highlights. I did want to return to the control panel and just talk about a few of the other tools before moving on back to the PowerPoint slides. So again, back on the control panel page, when we were building the site, we really wanted to make sure that along with the reports that you could share the data any way you wanted. So two things that are accessible on the control panel are this Valet system, and I'll explain that, and this download data. So all the data the seizure data that you enter into the site, you can actually go and export it in these 3 file formats. And you can define the times, or how much of the data you want to include by date, or you can just say include all my data. On top of that, we were approached by a family a year and a half, maybe 2 years ago, that had 2 children with seizures, and they said, your site is really hard to log with having 2 kids, and what we'd like to do is figure out a way to log into the site with 1 account and be able to manage our 2 kids. So we sat down and tried to figure out the best way to do that. And what we came up with is what we call the Valet system. It's a system where you can actually, from a user account, share a Valet key with a management account. So I can actually enter in an email here, send email to whoever I want to share access with, and it will send a link, which is actually a Valet key, through that email, and then that person can actually have access to the site or to your user account. You can every tool that's available on Seizure Tracker can be turned on or off to have access through that particular key. And then you have full control of that. So you know who you shared it with, you know what their name was, what status they are, and as far as access to your account. And then you can actually go in and edit all of these settings. So if you decide you want to give them access to do something or not, you can turn those on or off. And I actually will show you the interface that the management account sees. So that tool, the Valet system, has been being used within clinical care, but also group home care. It's great if you need multiple managers of a single individual or user account. So I'm actually going to switch back to that PowerPoint, and we'll try to finish up a little bit on showing you some of the other resources that are available that might not be so easy to show you in a live demonstration. So as we were thinking about access and portability, I mentioned that we were recording Evan's seizures on printed pages. So every form on Seizure Tracker actually has a corresponding printable form that you can access on the site, download as a PDF or a Word document, and then we would create these little books that we could log Evan's seizures in. And then the way the website is set up, I mentioned that it remembers all of the seizures or all of the previous seizures recorded. It was very easy for us to transfer his seizures into the website because they were all fairly similar. So we would log on paper, and then we could sit down and add about 40 or 50 seizures in to the website in about 10 minutes. So it was actually kind of fun. We'd prepare for our doctor's visits by logging in all of Evan's seizures, and we'd log in maybe 10 or 15 of them or 30 of them, and then we'd go and create a report and see what the graph looked like. I'll show you this is a form that is available on the site, and a lot of people in the U.S. are using these in their IEPs, which is an individual education program. It's a federal program for kids with special needs in school to be able to work with their parents as a team in their education. And so part of the IEP includes how to deal with the medical needs of the student. So a lot of families in the U.S. are actually including this form in there as a requirement for their IEP. It's just a binder form. I'm going to go back to this site. We actually, on top of having these paper logs, we developed a mobile optimized site very early on. So you could actually go to a data-enabled mobile device with a web browser and log in a very scaled-down version of the website, but similar to what the website looks like. And it's just a screen grab from that. And a few years back, when the iPhone 4 came out, it had a camera and a light on it. Unfortunately, Evan's seizures came back, and as I mentioned, we were being asked to video record his seizures, and we were doing it with a video camera. They're nocturnal in status now, so we have to give him rescue medications, and if the rescue medications don't stop the seizures, we actually have to call EMS and get them to our house as quickly as possible. So we would go to bed with our video cameras, a timer, and a phone. And when the iPhone 4 came out with the video camera and the light, we decided, well, let's just build an app for the iPhone and really make it into a seizure recorder. So this is, we actually just updated the app. So these are a little bit old in the screenshots, and the new update looks a little bit different, but functions very similarly. The Apple app is a seizure recorder. So you can press one button and it starts a timer. You press another button and it'll start videotaping. and you press another button, and or you hit done, you can edit that event in a library that exists on the device, and then you can sync the app up to Seizure Tracker, and the videos go straight up to YouTube. So that tool that we have where you can look at the videos that are attached to events get automatically uploaded to YouTube and attached to the events, and then they're available through the Seizure Tracker reports. So into the idea of how do we leverage this to really improve our care, and our whole thought process on the development of the site was we really need to be collecting better data on our son, and we need to be able to communicate that easily to our doctors, because we were definitely making decisions about our son's care based on information that was not accurate all the time. Lisa and I would go to these doctor's appointments and often argue about Evan's seizure activity, and then we'd come home and check it, and actually we were both wrong. So we really needed a way to communicate these, and then we also wanted to make sure that we had a way to know what we wanted to discuss when we went into these doctor's appointments and make them as effective as possible. So the site is for us to basically communicate with our care providers in a much more accurate and easily accessible manner. So again, the Seizure Tracker reports, you can include all of the data that's entered into Seizure Tracker. The Valet Management System, which actually can give your clinician easy access, immediate access to these Seizure Tracker user accounts, and they can easily manage multiple user accounts. So it's inviting for the physicians because it standardizes the way they look at this data, and they have direct access to it. So the Valet Management System, again, lets those management accounts look at every tool that's available on the site, create reports, and really understand whatever activity has been being recorded on the user side of things. This is how the interface looks and how easy it is to use the management system. So it looks exactly like the website itself, but you can actually pull down a menu of the names of people you have user accounts with, or you have access to their user accounts, and easily navigate from one person to the other person. Again, if we're giving this data, what does it actually do? So we're really trying to improve our care, or improve the outcomes that we get from using these different treatments and understanding how that works. Well, we're not going to understand it unless we collect the data and are able to view it in an effective way. And again, the Seizure Tracker graphs have let people look at this data over an extended period of time and see what impact it's having, both on the seizure activity, the seizure severity, and then when the seizures are actually happening, what the medications may be doing as far as blood levels. I also neglected to mention that we do have a hormonal tracker on the site, menstrual cycle tracker, that's available as well, and you can actually see that on the graph. These are not interactive, but you can roll over those to see more menstrual cycle information. So applying to more women's issues and catamenial epilepsy specifically. This is an illustration of how the diet tool looks and how it would be incorporated in the graph, and how you could actually see what impact diet changes are on. And I mentioned the daily variables tool. You can create customized icons within the graphs for different triggers or missed medications. Those can all be included in this um, this particular graph and can be looked at over a time span. As with anyone, I would think we'd be concerned about privacy. As we were building the site, we based our development on what we thought was important for ourselves, but our user base, and then also on kind of in putting into consideration HIPAA, or the U.S. Legislative coverage of health information and the privacy of health information and how it's collected and shared. So there's three major tenets of HIPAA: confidentiality, data integrity, and data accessibility. And we really tried to incorporate all of those ideas into our development and the website itself. So we had a strong security focus. We tried to make sure that our servers are up to date with all the security patches, and the design of the site and the way you log in and access your data is secure. The Seizure Tracker servers are actually housed in a secure private data facility and with very limited access, and they're on their own isolated servers. They're backed up every day on site, and then we back them up every week off site. So if something were to happen to the servers or something catastrophic in our data center, we'd be able to actually revert back to the data that was entered in previously. And then data accessibility, we really were thinking about how do you share the data easily, how do you access it and input it. And with our mobile system and the website, it seems like we have pretty good access to the data to be able to share it with our physicians. And if we decide to move from one physician to another physician, it comes with us and we can move it around as at will. So this is Evan. Evan is now 11 years old. As I mentioned, his seizures started again about 2 years after surgery. Mindy is his service dog, and we actually got Mindy 3 years ago from Ohio, and she is a seizure alert dog. So she lets us know when Evan is about to have seizures, and she's on top of that. She's helped Evan with his confidence. A tuberous sclerosis complex often has the individuals with TSC often have anxiety issues, and Evan has had far less anxiety since we got Mindy. So she's helping in with the seizures, but also helps in multiple other ways. So the website itself, we're hoping, it has improved our communication with our doctors. We do feel like it's helping us collect better data and communicate that data, and really empowered us to understand Evan's seizure activity and improve the care he's getting. So I kind of want to, I'll leave you with this quote, but understand that we are just regular people and are dealing with an unfortunate situation, and are fortunate enough to be able to have made a lot of friends through Seizure Tracker and been able to support other families. And I want to thank, again, Epilepsy Ontario for hosting us here. Thank you for attending and listening. I'm more than happy to answer any questions. I did want to mention we have a bunch of things in the pipeline, and actually have moved forward on some of these already. We last year put out a survey to our user base and asked what their interest in participating in research was, and we had a resounding positive to us sharing de-identified data, so data that you could not be linked back to our users with any personal information, but that our user base, 98% of them said they would be interested in having their data used for research. So we had a research initiative recently that we exported to NIH and had our first research paper come out at the American Epilepsy Society meeting last week on the placebo effect in clinical trials, which just having the amount of data that we have and understanding the impact of placebo effect in clinical trials and how that gets medications approved, particularly in the U.S., it was real interesting to see the amount of data and compare that to how data is collected in seizure clinical trials. We also have, in the U.S., I would imagine it's carrying over into Canada, a strong interest in understanding what role genetics play in epilepsy and the progression of epilepsy. And we have a focus on research initiatives that are genetic-oriented or genetics-oriented. And so we did build out a data share tool where users can choose to participate in data sharing with some partners that we have. So one of them is an industry partner that does, one of the current ones is an industry partner that does genetics screening. And we just want to make sure that our users can share their outcome data with researchers. And so we started off with this genetic screener to build this tool, and then it's now being used in clinical trials. And we are partnering with CURE, which is an epilepsy advocacy group in the U.S., and they are actually banking exome sequencing, and we're going to be partnering with them to attach seizure outcome data with that. So it's all user-initiated. The user gets to choose, the seizure tracker user gets to choose if they participate in those programs or not, and if they want to choose their data or not. We're moving into improving our medication collection system, and we'll also be hopefully adding a multi-language translation tool to the site within the next couple months. So again, thank you for listening, and it was a pleasure sharing the site with you, and I will go ahead and look at some of these questions. And we had a question about IEPs in schools, and I hope that was answered, but we do have the forms for IEPs within the U.S. And actually, I did want to mention the mobile system, the iTouch app. We have heard that a lot of families are actually sending an iTouch to school with their kids and putting it in their backpack and pull out the iTouch to record the seizures. Now, when you use that app in particular within the school system, the teachers are pulling it out, recording an event, and then contacting the parents right away and having them review the tool or review the event to see if the child should stay in school or not, or if they need to come home or get more medicine. So it's been outside of the forms. We do know that families are using the seizure tracker app within the school setting. There's another comment here on the site, and that just a user that's been using the site and has helped with their daughter for dosing. I'd really appreciate everyone or all the user feedback we get, and just to let you know that the site would not be the site it is without feedback from the user population. And so everyone should actually feel free. My email is on the thank you page, and you can email us at any point with questions or feedback on how the site is functioning. So with that, I'll hand it over to Suzanne, and I again thank you so much for having me.
Rob, that was a fantastic presentation, and the amount of different features that Seizure Tracker has at the moment, and the things that you've added to improve the functionality and to make it something that is really, really beneficial for people to use with all sorts of different needs that people and families may have. It's really impressive to see all of the things that the site has now, and the ways that you've modified it to really suit everyone's different preferences and different needs that they may have. I'd like to thank everybody for joining us this evening, and especially thank Rob for his presentation, and I wish everybody happy holidays over the coming weeks, and thank you very much.
Thank you. Thanks for having me.
Okay. Have a great night.